Thank you. Hello, everyone, and welcome to the Young Greens of Ohio and our monthly live stream. My name is Austin Bayshore. I am a Central Committee member of the Ohio Green Party and the liaison officer for the Young Greens of the United States. So today we will be discussing mental health care through the lens of Greens politics. So I would like to introduce our two co-speakers today, one being Mackenzie. Mackenzie, can you introduce yourself?
Hi, my name is Mackenzie. I am a member of the Green Party. I am the co-chair of the Young Greens of Ohio.
Welcome today, Mackenzie. And Marco, would you like to introduce yourself as well?
My name is Marco. I'm a fairly new member of the Young Greens of Ohio. So,
welcome today to the live stream. So again, our topic today for the live stream is mental health care. Unfortunately, we were unable to spot a guest today for this live stream. However, we will be discussing mental health care. So first, when we'll talk about healthcare in the United States does not have its own centralized form of universal healthcare. So what is universal healthcare and what does it look like? Mackenzie?
Yes, the definition for universal healthcare is a healthcare system in which all residents of a particular country are assured access to healthcare. So basically all residents, regardless of if they have a job, how much money they make, it's not tied to insurance through their job or through the Affordable Care Act. It's just everybody is covered. So that is the basic definition.
Many countries around the world have a form of universal health care that is not offered in the United States. Marco, what is universal health care?
universal healthcare is a system where everybody in the country gets healthcare free of charge for no matter what they get in their country.
Yeah, absolutely. So the United States does not have a form of universal health care, which is one of the only nations in the entire world that does not. If you have any questions for the live stream, please pop them in the comment section and we will get around to them for our two speakers today, Mackenzie and Marco. So again, the United States does not have any form of universal health care, which makes access to mental health care much more challenging for those individuals who need that. So in order to avoid this type of situation, we must first implement a type of universal healthcare in the United States, regardless of nationality, citizenship. So, Mackenzie, how do we implement universal healthcare and who's going to pay for it?
Well, all of us are already paying for healthcare one way or another. How we could implement it is taking the amount that we already pay, the ridiculous amount, and we can just use our tax money to fund it, or we can take it from the military, who we spend at least $700 billion on. We don't need to spend that much on them. We can take some of that money, move it to universal health care. And like I said, the amount we're already paying on healthcare individually, we can just even take a portion of that and move it to the healthcare system and where everyone would be covered. We can also take it from overfunded police if we're not going to move, because that will not only help the healthcare, that will also help our society. People will be treated for free with mental health. So yeah, that is how we could implement it.
Absolutely.
But we all would have, oh, sorry, go ahead.
Absolutely. We don't need to raise taxes a tenth of a percent when we give the military every year blank checks to run their program.
Yes,
Marco?
I would like to go back on what I said about it being free. Obviously, it would not be free because we'd have to take it from an area where we already are being taxed, but we're already being taxed that much, so we could just move it.
Even though the United States does not have a form of universal health care, the healthcare costs are already the highest in the world. So universal healthcare can only help that type of situation.
Exactly.
Marco, how can we implement universal healthcare and how do we pay for it?
Well, implementing it is we already have like I can say very a form of healthcare. It's just on the form of implementing it. So we could pay for it by to the military, and the rich in this country pay about 0 to 3% in taxes. So we could make them pay taxes to pay for it too by using our military and our police budget. And perhaps we could take the burden off the lower class people in America by lowering taxes on people like us in the country.
Mhm.
Yeah, absolutely. Nationalizing the healthcare services will do a lot of good work in alleviating a lot of issues that young and poor people face. For example, one of my friends recently moved from Korea to the United States. Her glasses in Korea were $30. However, she lost them while kayaking back in the United States this weekend, $400 to replace them.
And that's cheap for here.
Yeah. South Korea, one of the world's most capitalist countries, has universal healthcare. You can get your glasses prescription for $20, even as an uninsured foreigner like her. So it's wild to me that the United States does not have any form of implementation, and that it's tied to your work as well. So if you lose your job, you're going to lose your teeth too, if your healthcare even covers teeth in the first place.
Especially with what this pandemic has showed us, with multiple millions of people being laid off, they've lost their health care, and they didn't even try to make anything close to universal health care during a worldwide pandemic that we are still in, which is ridiculous.
Many socialist countries have shown us how to fight the pandemic. Cuba, Vietnam, China, they have pretty much eradicated this disease within their borders. The only COVID cases that China is experiencing these days are imported from the West. So with the universal healthcare system, we can eradicate diseases with preventive care and with strategic planning that the United States government does not have. So specifically, when we talk about mental health issues and times of a pandemic, what causes these mental health issues and how can we avoid them? Marco?
I could say a lot about our workplaces in America. We have a big work culture of like hustle culture, work hard, work long hours. That could put stress on people and some mental trauma and can form from that. So lowering work hours, 3-day work week, 8-hour workday, that could really help people with their mental health.
Absolutely. Burnout is such a huge problem we see in the workforce these days, especially with nurses, public service employees, and even cashiers. A simple service job as a cashier, a lot of people are developing lifelong mental illnesses due to the mistreatment and straight up abuse they face. Mackenzie, what causes these mental health problems that we're seeing in the United States today?
Well, there's a variety of things. There's this pandemic that has just been going on and on. There's pandemic burnout, there's workplace burnout, our ridiculous work hours that we're expected to do. There's the choice of having to choose between getting mental health or being able to pay rent for that month or being able to get food for your family, which just causes more stress. I would have to say stress is a big indicator, and the United States has had a lot of stressors in the past couple of years, but our whole time being here as a whole, honestly. But yeah, money, work hours, school, everything just kind of builds up to cause all these mental health issues that we are seeing today.
Absolutely. It is quite a big problem in the, especially how hustle culture in the United States, work 400 days and no break, really causes a lot of illnesses onto people.
And I'm sure we haven't even gone to the true number of how many people are really experiencing mental health issues, because to be diagnosed, you have to be able to afford to see a therapist or to see a doctor. So we don't even know how big the problem actually is.
Absolutely not, especially with patriarchy in our society and the machismo aspect where a lot of men a lot of people think men can't experience mental health issues or that they're
Or
meant to
if
hide
they
it.
do and they go and get help, they're weak, which is
Mm.
ridiculous.
And that leads to a lot of problems we see with violence around women, dating violence, and even terrorism that we see, where a lot of these people have mental health issues that they need help with, but because of societal aspects or because of their own political ideology, they can't seek the help that they need.
Yeah, mental health affects all areas of our society.
So what does productive access to mental health care actually look like? Mackenzie?
Universal health care first, being able to have access to a mental health facility or a therapist when you need it, your medicine that you take to help your mental health issues. I remember one time my insurance didn't cover my medicine and I had to spend all the money I had saved up for school that semester on that medicine. That stressed me out. That made my mental health issues worse for a little bit. So having access to free medicine, because no one should have to pay for medicine that affects their life in a good way. They're free therapists, free mental health issues or mental health institutions. And yeah, social workers being available at the scene of a mental health crisis that occurs instead of police. Things like that would be really productive to help mental health and to improve access to it.
Margaret, what does productive access to mental health care look like?
Like what Mackenzie said, having more facilities access for the people to go when they have issues, and more social workers and more affordable medication with your universal health care.
Absolutely. Affordability is one of the biggest strains we see in a capitalist society.
Mental health institutions shouldn't just be for the rich or the people who can afford $300,000 a day or 300, institutions.
Yeah. So capitalism is a main culprit in corrupt governments, as one of our commenters on Facebook points out. So how does capitalism negatively impact mental health services? Marco?
For the for-profit over actually helping people, so they'll focus on actually just the person with the issue having the money to use those issues, and they'll take those people over the per person who actually needs the help more. The poor person that actually needs the help won't have access to the services.
Absolutely. If you can't pay, you won't go. Mackenzie, how is capitalism negatively affecting
I agree with
healthcare services?
Yeah, I agree with Marco. They'll help the person who has the money before they'll help the person who might be experiencing homelessness and doesn't have money to pay for their prescription or their help. Also, like we said earlier, the hustle culture. You're just working away your life, not analyzing any of your trauma, not talking about it to a therapist to get the help you need. And yeah, you're spending tons of money on medication when you have to choose between buying medication for that month or, paying for rent, getting your kids to school, buying gas, food, so it just really does not at all positively affect healthcare. I can't think of one way it could positively affect mental health.
What would one solution be to this type, besides overthrowing capitalism? That's the end goal, but what is one or two steps along the way that we could take?
Sorry.
You say me?
Yes.
Oh yeah. Nationalizing our healthcare system, getting rid of the for-profit system around that to favor people like the working class people over money. So
yeah.
Mackenzie, what's a step along the way that we could take?
I would say making insurance not tied to your job. And like Marco said, making universal healthcare to where you don't have to choose. Just get rid of the choice between having to choose between getting help or having a place to stay for the night. Just that will be one step in the positive direction.
Definitely. All of these, as the more we learn about these systems, the more we learn that they're all interconnected, where the $15 an hour minimum wage is interconnected with the mental health care, which is interconnected with the military industrial complex, which is interconnected in women's issues, Native issues, African, Black issues, interconnected to LGBT issues, and even 4-day work week, something simple, single issue as 4-day work week, UBI. They're all connected to each other. And the main culprit in all of these situations is economics, capitalism. What is the best way to, as these changes that we're talking about probably won't happen until we're well within halfway through our lives, thanks to the ruling two-party dictatorship of the United States, which creates a system of politicians who say, well, vote for me because at least I'm not blue. Vote for me because I'm not red. And the system has created now, they've been using this argument for 22 years, since the 2000 presidential election. We have a system in the United States now where politicians and elected officials don't stand for anything. Their only policy is, hey, vote for me because I'm not them. So the changes we're talking about won't come about under the current two-party dictatorship. So how can we take power back into our own hands when it comes to mental health care, mental well-being, and just the overall arc of a well-being culture instead of a hustle culture? Mackenzie?
I know personally for me, I work out whenever I'm feeling really stressed. That's one way to improve my mental well-being. Also, that's just like a natural way. Also, get out and protest against these two parties, or protest for what you want and what you need. Don't doom scroll on Facebook. I do that often, and it always does not end well. Definitely pick and choose, if you are able, who you spend your time with and what you waste or what you put your energy towards. Not everything needs your energy. And some people or some things are just toxic. So if you are able, try to cut those out of your lives. I know it might be difficult, or it's with your job and you can't necessarily afford to do that. But yeah, it's things like that. That's what gets me through. That's what helps me. But yeah, and also protest for change. Again, who knows when these changes will happen? We can always be hopeful that it's soon, but that's my little life advice.
The outlook from the European Union and other multi-party countries when it comes to mental health care and healthcare in general is, well, Europe's not a country, but European Union and countries with multi-party democracies, is that we see these types of changes occurring already in countries such as Canada, where political parties actually have to form coalitions. So they're not just getting 50% plus one, and they get to change everything, demand everything, do everything with little to no opposition. These countries actually have to form coalitions and talk to each other, and the parties have to work together to pass progressive legislation that benefits the people. But in the United States, we don't have that. We have a two-party system where you get 50% of the vote plus one, and you get to do anything unchecked for the next 2 to 4 years. So Marco, what is the best way that we can take power back and focus on our own well-being?
To focus on your own well-being, you can just find something you like to do. Like, I like to read sometimes, scroll internet and about these issues too. But to get power back, you could advocate for these issues, protest, join groups like the Green Party, or just any group that advocates for these issues. So
we are the only party talking about these types of issues, talking about universal healthcare, the demand for affordable, egalitarian mental health care. We are the only national political party talking about it. In the United States, we only have 4 national parties. We're shooting on a 5th, but we have the obviously Democratic Party, Republican Party, the Libertarian Party, and the Greens. The 5th one that's shooting up now is the American Solidarity Party, which is a Christian, I don't know how to classify them. They're kind of like Christian democracy. I'd say like centrist, center-right, Christian democracy type of good social justice in accordance to the Bible type party. I don't know how to classify them, to be honest. But yeah, we are the only national political party talking about these types of things. We're the only national party that's willing to bring up the issues of capitalism is wrong. We need a new economic system in order for our lives to come into fruition. So, Mackenzie, what are some ways the Green Party has been advocating for these types of mental health issues and mental well-being?
Yeah, well, we advocate for universal health care. I'm pretty sure Howie Hawkins had a plan, if he was elected, of how to get universal health care. We advocate for voting rights for the Green Party and for everybody to be able to vote in people who agree with universal health care. So if you're one of those people who want universal health care, we also want it. Just a little plug there. But yeah, things like that. We also talk about raising the minimum wage and things like that, and how everyone should have access to good jobs and yeah, things like that. That's how we have.
Yeah, absolutely. We've seen in many countries that have Green Party members of their parliament or Congress enacting good legislation for universal healthcare, expanding, not only creating universal healthcare in many countries, but also expanding it. To some countries in Europe even have universal healthcare now for your pets. So your animals are being taken care of under their universal healthcare plans. And we can't even get our eyes insured in the United States.
Exactly.
It's absolutely pathetic. Marco, how has the Green Party been pushing these mental well-being initiatives?
Oh, we had candidates running on universal health care and just other policies like the environment. We've been advocating for on social media, like the minimum minimum wage, ranked choice voting, universal health care, all that stuff. So.
Exactly. We've been on the forefront of this fight since our inception in the 1980s. Mackenzie was there a few months ago when we did a live stream with the Future Generations Commissioner of the Government of Wales. If you don't know who she is, very exciting position specifically to the Government of Wales in the United Kingdom. This Generations Commissioner is solely focused on improving what she calls well-being. Mackenzie, do you remember what she described well-being as?
Oh man, that was a really good live stream. I believe she said that she had the people vote on it or like take a survey, and it was better, the better environment, better places to walk to, better work conditions, things like that, I believe.
Yeah. They are now no longer in the Government of Wales judging their economy based on GDP. They're no longer judging their country's output with their production for capital or their economic output. They are judging how good of a country they are based on wellness, and they have multiple factors. They're starting to do this in New Zealand too. They have multiple factors saying, like, doing surveys asking people, are you happy?
Mm.
And people can say either yes or no. Like, why? Why are you happy? Why are you not happy? Are you making enough money to survive? What do you want to see in your community? And these people say things such as, oh, we want more bike paths. Oh, they did a survey where the central government in the UK was planning on expanding the highway in Wales, which would take up a bunch of farmland, cause a few people to move. And they put out a survey and they said, would you like the highway to be expanded? And the people said, no, we want better access to public transit. We want better healthcare services. We want all of these things instead of an expanded highway. And they didn't expand the highway. They listened to the people and they didn't do it. There are discussions in Ohio to expand some of the highways too. And I wish the government would do something like that in Ohio. Ask us how we feel, and if we even want this in the first place, or do we want better access to public transportation? do we want, not access, do we want a public transit system
Yeah.
in the state of Ohio to begin with? So Marco, how can judging our country on well-being be different than judging it on our production to capital?
Well,
Economic.
we wouldn't be using the profit motive, we'd be using the people motive. So we'd probably have better public transit and just better healthcare and well-being for the people and the whole country or state, whoever can get it implemented.
Absolutely. We definitely need to shift towards the Welsh New Zealand model of people's happiness, people's livelihood, rather than our production for profit, because we live in a world where we're going to run out of options for production for profit. We are a finite planet acting as if we have infinite resources, and someday, sooner rather than later, that world is going to end. So I want to thank Marco and Mackenzie for joining us on this live stream about mental health care and healthcare in the United States. If you have any questions or if you're interested in joining the Ohio Green Party, please visit our website, ohiogreens.org/join. Again, I want to thank our two presenters today, and we will see you all next time.